So we'll carry on with some special tests. If we are checking for scaphoid, this is regarded as a potentially serious injury. We would look for what's known as the anatomical snuffbox. To find that, if you ask your client to abduct their thumb, so if you can move like so, you can see, and hopefully you can certainly palpate, the hollow in between the two abductor tendons. That is known as the anatomical snuffbox. And if we then put pressure on there, making sure that we are pressing towards the thumb, not towards the styloid process of the radius. That bone there that we'll be palpating is the scaphoid. Any tenderness there following a fall, one should get them off to hospital and get that x-rayed, and they may well take a precaution in putting a splint on just to secure that. If we look at any problems with the hand and tendons in this area, there's one that we know as mallet finger, where the extensor tendon has been avulsed from the distal part of the finger, and what you would observe is the distal part of the finger slightly flexed over and unable to extend. So obviously, to confirm that with any test, you would simply flex the end of the finger and ask your client if they can contract and pull that back against resistance. Obviously, if they can't, then it will be an indication that that tendon has avulsed away. So that is mallet finger. The opposite, if we turn the hand over, in flexion, the flexor tendon may have avulsed, and this is known as a jersey finger. So you'd have the same problem there. Trigger finger often affects the third and fourth fingers in the hand, and basically what happens here is when the client tries to flex the fingers, there is a sort of jarring action, so we may see the finger sort of click, click, click like so. And what's happening here is that there is a tenosynovitis problem where the tendon has thickened and is trying to pass through underneath the retinaculum. There is a sort of jarring motion, and sometimes in severe cases the finger can stay flexed, and it's very hard for the client to actively return the finger to extension. So that's the sort of thing that we would see with trigger finger. Two more that we may observe. One is known as Dupuytren's contracture, and this is purely observation. What we would see here is the flexor tendons, particularly of the fifth digit and sometimes the fourth as well. You'd see that sort of appearance where they've contracted over time. Very sort of difficult condition to stop, but sometimes now surgically they will sever the tendons to get the fingers back into extension. Another condition known as de Quervain's syndrome. It affects the abductor tendons, and here if we simply ask the client to flex or abduct the thumb, clench like so, and ask them to actively just move into ulnar deviation. They may feel pain or discomfort in that area there. If that doesn't work, then we can passively stretch like so, and sometimes that can be uncomfortable. So the final test that we're going to look for now is carpal tunnel syndrome. So this is where there's an impingement in the carpal bones here that form the channel for the arterial nerve supplies to the hand, and if that is compressing around either of those types of vessels, then it can cause problems with the hand. So what we would ask our client to do is to get into this position with both wrists flexed, and simply ask them to hold this position for 1 minute. If during that time there is an increase in any sort of uncomfortable sensations into the hand, then this is a clear indication that there is an impingement taking place there and needs further investigation.